But for as long as I've been analyzing the state budget, since 1991, when I was at the Comptroller's office, Texas has ranked in the bottom 5 in per capita spending. And it's because it's also ranked in the bottom 5 in taxes per capita. So we'll talk about that. Dick will talk about the state revenue picture. And then I'll come back and talk about what's in the supplemental budget proposals for 2017. The year we're in right now, and then finally other bills that we are watching at CPPP because they affect budget choices that the next legislature will have to make. So it's not strictly appropriations bills, but other policy proposals on the revenue or spending side that could have an impact on the state budget. So that's our outline. And again, if any of you can't hear me, I'm talking as loud as I can, but please move up. We have chairs at the front. Okay, the state budget context I mentioned is what I'll talk a little more about first, and I touched on the first. We rank very low in state spending, and we have done that. You actually have to go back to the 1930s to find a time when Texas wasn't way at the bottom. So in the 1930s, Texas ranked average in state government spending, but I think that's because at that time the Great Depression was happening and nobody had money for anything. So we were average when average was rock bottom, I guess. The issue of being a rapidly growing state, it's not so much just the total population, but where your growth is coming from. We hear a lot about the miracle, the Texas miracle that's drawn people from other states, voting with their feet, the U-Haul thing, all of that stuff is like, what that ignores is that half of our population growth every year, all the new Texans, is just straight out births, like just people being born here. That's called a natural increase in population. So even if people were to stop coming here from other states and other countries today, we would still have usually the second or third highest birth rate. Frances is here, a former kids count director. She can tell me exactly where we're at. But a really high birth rate is what drives our population growth. Some of you may also have heard Steve Murdoch talk about this. It's like, again, just sheer birth rate is what's driving our population. That has a lot of implications for the state budget because we have a lot of children in our schools, a lot of children needing ECI and other early intervention services. We have a lot of families with young children, and if you understand a lot about economic statistics, the more young children there are in a household with young parents, the more likely they're all going to be in poverty. So the younger you are, the less money you're making. If you have children, you're going to be low income. So we'll look a little more at that. So again, not just the total population, but people who aren't going to be able to afford private school and private health care. So the state has to come in and make up for that. I'll go touch on that low tax and low spending thing for one more second, just because the issue there is when we're in a cutting mode, as we are this year, you can't cut what's not there. That's the problem. When you are low spending, when you're 47th in per capita state spending, you don't have as far down to go as other states that rank in the top 10 or that rank even average. So we don't have a lot of things that we can cut. We are providing the bare minimum in so many programs. So 2003, some of you may have been around for the massive cuts that were made to state services in 2003. Mental health cuts were among them. In 2011, we saw even bigger cuts to public school finance that we have not completely recovered from. So another thing we point out as we go through the House and Senate proposals is we are making cuts to things that were already cut in previous legislative sessions of writing the budget. This is a chart that shows why we are so low in state spending. We need to bring in local comparisons, local government comparisons, because some of the issues we work on at CPPP, some of the things you advocates out there work on, they don't look just at what the state does, but the state and local partnership. That really matters, for example, in public school finance. That's something that is a joint effort of state and local government, school districts. Child Protective Services is another thing that in some places it's more of a county function. So if you're going to compare Texas to other states, looking at what we do, state and local government combined, and then adjust for our Texas population, which at this point is 27 million people. So the latest ranking we have is from the Census Bureau. What you see on the left there is the the left is the U.S. The yellow at the bottom is state government spending per capita, about $3,900. In Texas, that is coming in about $700 lower. So that's $700 less that the state budget is providing per person. Locally, for a rank of 47th place. Locally, we're doing much better. We're at the average, actually. State spending, 47th. Local spending, 25th. So there, the difference between the Texas and the U.S. number is more like $500. So it's really the state inability to fund services because of our low tax effort that creates this disparity. I mentioned earlier about how it's not just our population growth, but what kind of growth. What we unfortunately see in Texas. I got the opportunity to talk to Evan Smith's class last week, and he wanted to know how CPPP approaches the budget and what our approach to it is. So I went back actually to when CPPP was created in the mid-1980s, just to kind of get the really long view. We exist basically because we don't think that health care is something that was being provided by the state to people who needed it. And then related to that is a lot of other access problems that are created when people live in poverty. So some of the groups that are on the other side of the political spectrum think the economy will take care of all these things. If we just grow our way out of it, that's the way to go. We really think that some structural changes in the economy would be needed first to make that happen. For example, a minimum wage increase. We have not had a real improvement in the minimum wage since the late 1960s, like what it would take to get back to what the minimum wage did for American households. And if you want more of an understanding of what that does to people in Texas, go back and listen to Senate Finance's Health and Human Service hearings, and there were many people there testifying about how low of a wage we pay community care attendants and what that means for the workers and for the people that they're taking care of and helping remain in their homes. So a minimum wage is long overdue, but until we make those structural changes and have higher quality jobs, higher paying jobs, we'll see more of this. This is the Texas poverty rate going back again to 1980, and what you see here is it's going up and down, but it's always between 15 and 20%. People that are low income is about twice that rate. So you're talking about 30% of Texans that are low income. That means people basically can't afford to buy the basics. They can't afford to buy health insurance, is the usual big one. It means their children are low income and qualify for school meals. It means economically disadvantaged kids in school are more than 60% of our enrollment. So it's just the basic poverty that we haven't really eliminated. Even in the good times, it goes down to 15%, but then it goes back up to about 18%. In 2014, 2015, that where we are now, that's 4.2 million Texans below the poverty line, almost 10 million who are low income. And again, minimum wage will fix a lot of this because Texans are working, fewer than 5% are unemployed. But if they're not making wages that lift their families above poverty, the economy is not going to grow us out of this. Related information about our uninsured rate. Just started a little busier because the Census Bureau keeps changing how we count the uninsured. The current population survey and the American Community Survey both track uninsured residents of all the states. Here we're looking at everybody in Texas, all years, all ages. And what you see here is, again, like you saw in the poverty chart, Texans that don't have health insurance has never gotten below 20%. Sometimes it's been as 25%, but it's always just kind of stayed there in between 20-25%. The population grows, same way it did on the previous chart, so every year we had more and more and more uninsured Texans. And then look what the Affordable Care Act finally did, starting in 2011. We finally saw some really huge improvements in our uninsured rate. So that's where we're going to be having to wait and see what federal decisions do to the different parts of the Affordable Care Act. The health exchanges, the policies that let kids stay on their parents' policies, all of that, we'll see what happens. But the problem is that in Texas, we have to write a budget that doesn't quite know for sure what Congress is going to decide. So I'll be talking about that in a little bit, but we have to write a budget that takes us through 2019. The federal decisions that are part of that get made this year by Congress and then again the next year. So we have to basically do what we need to do without knowing for sure what Congress will do. So the Affordable Care Act is a pretty big one as far as access to health care. All right, so I'll touch on a few things related to where the starting point budgets came from, and then I'll turn things over to Dick. First of all is when the House and Senate introduced their Appropriations Acts for 2018 and 2019. Senate Bill 1 is the General Appropriations Act, and House Bill 1 is the similar one on the other side. Everybody says the Senate goes first this year, but they really are two totally separate tracks. If there's any legislative staffers in here, you just kind of, the House Appropriations does its thing, Senate Finance does its thing. Senate Finance has heard all the public education, higher education, and Health and Human Services parts of the budget. So they're about 80% done, basically. But what we heard from Senator Nelson at the very beginning, she released the budget even before Senate Finance was appointed. She called it a starting point. Any of you who have been to those hearings, that's probably the first thing she said. This is a starting point. We're going to see what we can improve. But it comes in below what we're spending right now is the main problem. So there is no attempt to deal with cost increases in the next 2 years. So we honestly hope she means what she said, that it's a start, and that the ending point ends up a lot closer to what the House is proposing. Speaker Strauss got a little more detailed when he released the budget. There hasn't been an appropriations committee named yet, but he basically said, he mentioned an economic slowdown. I think there the reference was to what happened in this current cycle we're in. The forecast for the next 2 years shows growth, but again, Dick will talk about why that's not generating more general revenue. But if you notice what both the senator and the speaker are saying is balanced budget is what we have to end up with. And by that they mean they can't spend more money than the controller says is available. General revenue and economic stabilization fund are what's available for the general revenue budget. All right, finally a budget chart. Anybody who's seen me knows where are the budget charts? You've got to have a budget chart. Okay. Here we see specifically how low the Senate proposal is. And we're talking about all funds here because you have to spend general revenue to draw down federal money, especially in Health and Human Services. So the all funds is what matters as far as how well we meet the needs of Texans in the next 2 years. The Senate proposal, we'll start with that one because it, for 2016-2017, is actually lower than what the House is talking about. So if you understand the Senate budget, one thing about it is it starts cutting this year. It doesn't assume that we're going to pay some supplemental bills that are needed for Medicaid. And that's a pretty big thing to leave out. It's about, let's see, $2.5 billion almost, all of it for Medicaid. So this is where we hope the Senate changes its approach really quickly. Not paying $2.5 billion worth of Medicaid bills by this August, we don't think is an option at all. They don't have time to be making that sizable cut. So, but right off the bat, they start off at a different place. The House assumes we're going to pay the bills that have developed over the interim. The governor I won't talk about as much. His budget proposal is like 50 pages. He's talking this year about a hiring freeze for most state agencies, not Family and Protective Services, because we're trying to fix CPS. But he would not want any new state employees to come on the payroll, any agency that he has authority over, not other statewide elected officials. He thinks that would save about $200 million. But again, we need to have a lot more added just to not cut current services. 2018-2019, you see a pretty big difference. The Senate is talking about in the next 2 years, $213 billion in all funds. That's less than what they're proposing for this biennium, which is already a cut. So they cut from where we are now, and then they cut again in the next 2 years. Factoring in Texas population growth and inflation, the LBB says this would be a 9% cut. If you look at both of the funding that's not provided, this budget and the next. And the governor, again, I won't get too far into it, except that is worse than the Senate in almost every area of state spending you can think of. The House proposal is the better one, but it still cuts state services by almost 6%. One thing that doesn't see a cut in the next 2 years is highway funding. That would go up by 14%. Adjusted for inflation, that would probably be about a 6% real growth in highway spending. But it's got its own separate funding sources, so it gets more money. Everything else in these starting point budgets, almost everything gets less. More details on the Senate. Again, I'll stick around for more detailed questions, but you might look at the Senate budget and think that's not so bad. If you look at Health and Human Services, for example, $78.5 billion in the current budget. Again, they're not doing a supplemental for that. $77 billion in the next one. That's only a $1.1 billion reduction. So what I've highlighted is this Article 9, General Provisions. That is basically the Senate's attempt to balance the budget kind of at the very end. They went ahead and allocated funding to all the different articles, but we really wanted to make sure people understood in Article 9, there's something called Section 1505, which says, okay, everybody who's not the foundation school program needs to cut another 1.5% out of their budget. And if it's something that gets federal matching funds, that's an even bigger loss to those agencies. So it may look bad enough when you look at it. All those red lines are where the Senate is proposing less than we're doing right now. It's even worse when you factor in the additional $1 billion of cuts. I mentioned before that the 85th legislature has less general revenue, but it has more money overall. That's why we're seeing a highway funding increase. I also touched on the fact that congressional and White House changes to the big sources of federal funding for Texas may mess up 2018 or 2019 assumptions. The legislature for many programs has to decide how much to spend in general revenue to draw down federal dollars. Others are completely federally funded. Some state services like nutrition and meals are 100% federally funded. So we'll alert you to some of the more scary proposals that are coming out and how they could affect state services. But the legislature has to just go ahead and do this, finish up by May, have a budget in place by September. Real briefly, the federal funds that we're talking about here, just to give you a sense of proportion. The giant bubble that you can probably see even at the way back of the room, Medicaid just in 1 year brought $22 billion of federal funds to Texas, which is about 6 times as large as the next biggest thing, highway funding. So we're talking about some pretty major categories of state services where it's the feds who will be deciding a lot of this. Some of the other programs that maybe not be so visible from the back of the room are...
Check.
Stop yelling. Okay. Education spending, school meals, TANF, WIC. There's a lot of programs. Again, the Congress decides, the state administers these services. But understanding what's a match and what's something Texas has never taken advantage of. Those of you who are here that have worked on Medicaid expansion know the Medicaid funding we're looking at there could have been much more significant if we'd done the expansion. But this is at least the status quo we're hoping to maintain. Last chart before I turn things over to Dick is where we are in this chart. Our communications people do their best to make our analyses look very interesting and just make you want to know more about the state budget. So this is one of the things they came up with. It's on the table, there's plenty of copies. But what this explains is the state biennial budget cycle, the 2-year cycle. And right now we're in the odd numbered year. Last year we were in that inside circle, the even numbered year. So all the things that happened last year, the budget instructions that went out to agencies telling them cut 4% from your budget, asking for another 10% round of cuts, all of that happened last summer. Some of you may have been at the hearings in the fall There are public hearings in August, September, October, where you can go and say, this is what the agency has proposed based on your instructions, but we really need to reduce community care wait lists, or we really need to do something about Zika, or to restore women's health programs to what they were before 2011. So those public hearings give you a chance to say what isn't even being talked about. The other big things that happened last year were the state, the LBV adopting a state spending cap and a minimum balance for the rainy day fund. So lots of things happen in the budget process before the legislature even arrives. The thing that matters the most, the single biggest thing that matters, is the announcement of the biennial revenue estimate. January 9th, the controller told the House and Senate and the governor how much revenue he was forecasting through the next 2 years. And basically that's what the legislature is going to have unless they want to tap the rainy day fund. And then what happens in the next 5 months is already underway. Hearings in both the House and Senate, and a marked up budget that has to go to a conference committee. So I'll stop there, turn things over to Dick, and come back and tell you a little more about what's in that other handout we gave you.
Hi, thanks all of you for coming. I really appreciate your interest. My name is Dick Levine. I'm the very senior fiscal analyst at the Center for Public Policy Priorities. And I just want to let Eva take a break and also explain to you why, if the economy's good and the jobless rate is low, how come there's not any money to write the state budget? It is a little bit because of oil and gas, and we know the effect it's had is specifically in Houston and other parts of the state, but it is mainly because of decisions the legislature made in 2015 and before that has really restricted the ability of the Appropriations Committee and the Finance Committee to write the budget that we need, because as the controller said, normal revenue growth has been pre-dedicated. It's been sent other places, committed to other reasons, and not available to write the budget. So let's start with a little background of where does the money come from. This is where state revenue comes from for all funds. About half of it comes from taxes. About a third of it comes from federal funds. Ever showed you the one with the great big balloon for Medicaid. The lottery is that tiny slice at 10 o'clock. The only reason we pulled that out is because everybody always asks, how come we need to use property taxes and pay for public schools? I thought the lottery paid for public schools. And in fact, the lottery does pay for public schools. Not originally, but the legislature soon realized that was a public expectation. So now the net revenue from the lottery is dedicated to the foundation school program, and it's about $1 billion a year, and it pays for a little less than the first week of school. School funding is over $40 billion a year. The lottery goes there, but it doesn't make any difference. And in fact, it doesn't even add to the amount available for the schools. It's just some of the money comes from the lottery instead of coming from the foundation, from general revenue or someplace else. The next slide, we're talking about just the state general revenue sources, so not the federal funds or some of those other things. And you can see that of the half of the state revenue that comes from taxes, more than half of it comes from the sales tax. That's a big slice there. And next to it is the motor vehicle sales tax, which is technically separate, but is essentially a sales tax when you buy a car. So that's nearly 2/3 of revenue coming from essentially sales taxes. One problem is, of course, that goes up and down with the economy. And another thing they won't talk about in detail is the sales tax is hugely regressive. What that means is that it takes a much larger proportion of the income of a low or moderate or even middle income family than it does from an upper income family, because lower and middle income families spend everything that they've got just to keep their families going, but people at the top end can afford to do whatever their families need, plus have money left over for savings, Plus, if they spend the money, often it's spent on services, legal services, stockbrokers, real estate agents, accountants. None of those things are taxed by the sales tax, but they're used disproportionately by higher income families. So one of the big problems with our tax system is those who can least afford it pay the most. And this is why, because of the sales tax. Then as you look around 9 o'clock, you can see these are some of the business taxes. The oil and gas tax is paid by whoever owns the well based on what comes out of the ground. The franchise tax we'll talk about a bit in a minute, and the insurance tax, and then across the top we have the lottery again, and the other odds and ends like the cigarette tax and alcohol taxes. But mainly it's a sales tax driven system. Now, let's look at the sales tax over time. And you can see it grows. Texas has been growing. The economy's been growing. And I hope you can see it, especially from the back. But we divided them into the two different bars. One is all funds, and one is GR related, general revenue related. And pretty much there wasn't any difference until recently. And you can see what happened is the all funds, the total sales tax collections, keeps going up. But the GR related, the part that the Appropriations Committee and the Finance Committee can decide what to do with, went flat. And this is a good time to explain what happened. This is something that the last legislature did and then sent to the voters because it required a constitutional amendment. What they said is once the sales tax reaches $28 billion a year, the next $2.5 billion goes straight to the highway fund, and then only if you get more than $30.5 billion, the 28 plus the 2.5, then the rest of it comes back to GR. And what's expected, according to the controller's revenue estimate, is we're not going to get to $30.5 billion. So the highway fund, in fact, is not even going to get the $5 billion they were hoping for. They're going to get a little bit less. But more importantly to what we're talking about is that means that there's essentially a cap on sales tax revenue. The source of most of state tax revenue, as I just pointed out, is being held flat at $28 billion for the next couple of years. That is a huge amount of money that's no longer available for the budget. And you can see in this slide what that means. The right-hand bar, the one that goes below zero, is the money that, the less revenue that's coming into general revenue. Half of that is the more or less $5 billion that's going to highways. Most of the rest of it, $2.6 billion, is the franchise tax cut. This is something that was passed last session. The franchise tax, also known as the margins tax, is a major tax that's paid only by business. It used to be essentially a corporate income tax. And in 2006, in response to the state Supreme Court opinion about school finance, it was changed. What they did in school finance is require all school districts to cut their M&O tax rate, their maintenance and operation tax rate for annual expenses, by 1/3. Most of the districts were at $1.50 per $100 of property value. They had to cut it to $1. So their property tax revenue was cut by 1/3. But the state said, don't worry, we'll take care of it. You will be no worse off because we'll give you extra state aid to make up what you're losing in property taxes. And then in order to fund that extra state aid, they raised the cigarette tax a bit, and they changed the old franchise tax into what's now called the margins tax. And the reason it's called the margins tax is it's based on the margin, or the difference, between gross receipts, everything that business brings in, and either their cost of goods sold, what they buy and then they process or package or use in manufacturing, or their cost of compensation, what they pay their employees. They figured that difference between gross receipts and either cost of goods sold or compensation, and originally most companies paid 1% of that difference. What the legislature did last session is they cut that 1% to 0.75%. So they cut the money coming in from the franchise tax by 1/4. That's $2.6 billion we don't even see. It doesn't even get here. Unlike the sales tax, which gets here and then goes straight off to the highway fund before anybody can make any other decisions on it. Then on the left-hand bar are a few extra commitments that were taken on last session that means that much less is available for discretionary spending. Two parts of that. One is that DPS and the Department of Motor Vehicles used to be funded out of the highway fund. Now they're funded out of general revenue. So that's a commitment that's been made, and DPS in particular, of course, is now a lot bigger because of so-called border security expenditures. The other is the Homestead Exemption. Last session, the legislature proposed to the voters, had to be a constitutional amendment, and the voters approved an increase in the school property tax exemption. It's a statewide mandatory exemption. Everybody used to have a $15,000 exemption. It's now up to $25,000. That means if your house is, say, a $225,000 house, you don't pay taxes on that full $225,000. You pay taxes only on $200,000. We, in fact, were in favor of this at the time because since it did look like the legislature was looking for tax cuts, between the various things that were on the table, this looked best to us because it helps offset the regressivity that I mentioned. Because at least among homeowners, everybody gets, as it turns out, about $125 a piece, or at least gets a tax break worth $125 a piece. And obviously $125 makes a much more difference to a lower middle income family than it does to an upper income family. This is independent of what you may have been reading in the last couple of days about the optional percentage homestead exemption the TEA is now recognizing as a cost for rich school districts. That kind of exemption is the opposite of this flat dollar amount. It's 20%. 20% of $1 million means you save $200,000 off the taxable value. 20% of a $200,000 home means only $40,000 off. So this is a relatively progressive thing, but it costs money. If you add up all these bars, the franchise tax cut, the diversion to the highway fund, the extra formerly funded by highway fund stuff GR now has to do, and the homestead exemption, plus at the bottom of the right-hand bar is a little $1 billion extra in tax cuts that passed in 2013, adds up to about $10 billion. And if you like numbers, here are the numbers. I'm not going to run through them all, but you can see it starts with how much money comes in. You set aside some for the highway fund. You add in the other sources. You have to set aside a little bit extra for the rainy day fund. And you have available a cash balance. Well, last session they came in with a cash balance of about $7.25 billion. This time when they're coming in, they have $1.5 billion. And as you know, there's always a supplemental appropriations bill to get us through the rest of the fiscal year. A lot of that's probably going to go to Medicaid. An extra $100 million of it is going to go to schools because of the decision TEA just made last week. So it is entirely possible that the supplemental appropriations will have to be even bigger than the cash on hand. So where are they going to get the money? Do we have that coming up? There's more numbers that I just told you about. This is where you can get the money. You can get the money from the rainy day fund. That's what it's for. The rainy day fund was established in the late 1980s when Texas was much more reliant on oil and gas, and oil prices totally collapsed. Now, one response of the legislature at the time was actually to raise taxes. The sales tax had only been 4%, and now it's up to 6.25%. And that happened in the 4 or 5 years after this price collapse. Gasoline tax went from 10 cents to 20 cents. So they took what I think a very reasonable response. If you need to maintain your services, you have to raise taxes to pay for them. But the other thing they did is they started to create a savings account. And the rainy day fund, it's actually known as the Economic Stabilization Fund. And the reason for this name is the idea is to stabilize the budget when you run into hard times in the economy. Or think of it as like filling in the potholes. So you get a smooth course from one year to the next. And it's been used. You can see the I guess that's blue and red bar shows you, the red shows expenditures they've made. And they've made expenditures all the time for ongoing expenses. There is a feeling now it should only be used for one time. That's not the original intent. That's not how it's been used until the recent past. It's there, it's available, and it can help make up for all these decisions that the legislature made in the last session or two that have put such a squeeze on the budget. The other thing you can do, of course, is, and there's a provision to do this, just cancel that sales tax transfer to the highway fund. In fact, the Sunset Commission, I believe, has found that TxDOT's not able to cope with all the money that's flooding into it now. They can just take a year or two break. We can use the money to maintain funding for health and human services and public education and everything else we have to do, and then it can go back to the highway fund. So there's a rainy day fund, there's postponing the sales tax diversion, there's things we can do to avoid the totally harmful cuts that Eva started outlining. I think we have one more slide with more details about how the rainy day fund has been used in the past. But, last slide before Eva gets to stand up again. This is just a step back. We've been talking only about the state budget so far. Now we're going to talk about all state and local spending and where the money comes from. And you can see that the state is a highly sales tax dependent government. But overall, when we look at all taxes the Texans pay, we're mainly a property tax state. Almost half of all taxes paid are actually property taxes. A big chunk of the rest you can see are sales taxes, both state and local. And of the property taxes, more than half goes to the schools, and then the other half is split pretty much evenly between cities, counties, and special districts like community colleges and hospital districts. So the reason I wanted to emphasize this is Senate Bill 2 by Senator Betancourt, among other things, would really limit the ability of local governments, other than school districts, to raise the revenue they need to support public services. And if you look at most city and county budgets, those public services are mainly public safety, fire, police, EMS, and for counties, courts and jails and things like that. So that's where they're putting the pressure on, making it harder for city councils and county commissioners, when really, if they're interested in cutting property taxes, they should look at school property taxes, which is more than half of the total. And the way to cut school property taxes is to increase state aid so school districts don't have to raise it themselves by raising their tax rates. So I may have taken a little more time than I needed, but I think it's important to understand what's behind the difficult choices that are going to be made in the budget. Now it's Eva's turn again, but I'll be happy to hang around when we're done to answer any more questions. Thanks.
Okay, now we're going to go back to talking a little more about what's being proposed for 2017 and then for 2018, 2019. So keep this handy because I'll be referring to it. First, we'll start off by looking at the budget that the legislature actually wrote 2 years ago. In 2015, the legislature left town and they thought $106 billion in general revenue, $209 billion in all funds it was actually praised at the time as a conservative budget. So nobody thought this was too much to be spending in 2016 and 2017. At the time, they knew they weren't covering medical cost increases in Medicaid. That's a bad habit the legislature's gotten into recently. They will put in money for caseload growth. Children, people who are elderly and low income, people with disabilities who qualify for Medicaid. The caseload growth is usually in the budget, at least partially. Medical inflation is not. So they knew $800 million at least was going to be needed for Medicaid by the time 2017 was over and done with. They just didn't put it in the Appropriations Act. It's grown considerably to that $1.2 billion I mentioned because in the interim, the leadership has decided we need to do something about CPS. There's a rally about CPS actually at 2 o'clock, so please go and join that effort. But they knew something had to be done and it couldn't wait until 2018, so they basically borrowed money from Medicaid and they made that shortfall much larger. There's also, that's the major thing that's changed the 2016-2017 state budget. look at a few more numbers. Again, I mentioned the Senate assumes this doesn't happen. I don't know how, but they just assume we're not starting with that 1.2 billion to cover this year's Medicaid bills. It's just not there. Along with the federal matching funds, it would draw down. The Senate does assume other supplemental spending for family and protective services, education, the foundation school program, higher ed. So they do add another $800 million for the 2017, but not that big one. So we really need to know what exactly they're planning to do in the remainder of this year. So again, the appropriations that the legislature does up front is always different from the budget that ends up being paid for after the fact. They're guessing 2 years out, but at the time they thought 106 billion would cover pretty much everything except medical cost inflation. 2018-2019, we're taking that basically what the House is assuming about 2016-2017, the gray lines are where we are now. Now we're talking just about general revenue. This is a chart that's in the side-by-side. Remember at that end of that chart that Dick showed us, 105 billion almost in available general revenue. Add up what the House is proposing for the next 2 years, and you get almost 109 billion in general revenue, and it's allocated the way you see here. The Senate is proposing only 104 billion roughly. So they're not even using all the money that the controller says is available. Neither the House nor the Senate come right out and use the Economic Stabilization Fund, but the House's proposal of almost 109 billion clearly shows that they're willing to go beyond the general revenue limit, because they already knew what that was when House Bill 1 was released. So they're willing to say we need to do more than just the general revenue that the controller told us about. So that's basically what we need to work on and ending up with at the end of the session, a budget that looks more like the House's proposal and way less like the Senate's. The key areas that you see circled there are where the Senate drastically underfunds health and human services. Again, this is just general revenue we're looking at, so the federal funds lost because of these proposals are even bigger. Higher education is another area in the Senate budget that comes in way below either what we're doing right now or what the House is proposing. So the handout that we prepared takes you through area by area. And again, it gives you the top line numbers, how much general revenue, what's this Article 9, Section 1505 thing, what could we do with the rainy day fund, the economic stabilization fund. So the top level information is all on that front page. And then just to make sure you understand how to read the next few pages, for each single area of the budget, these are things that CPPP works a lot on. The foundation school program, high quality grants, higher ed, health and human services. First we look at what are we doing right now. For Medicaid we add in the supplemental because we think that has to be done. And then what are the House and Senate proposing in the starting point budget? And then finally, what else do we think you need to know? What do you need to understand? Some of you advocates, we always hear later after presentations, actually what you didn't mention is this, or what they've done is they've combined things and it looks like an increase, but really it's not. So any other information that you want us to know about, feel free to call me or email me. But at least what we can see in the high-level summary documents, we want to bring that to your attention so you can go to a hearing and talk about what's not there, where there's really room for improvement. But again, that's the key areas that we work on, and we'll be updating this after the House and Senate mark up their budgets and then at the very end of the session. So we'll keep you posted on how things are going. Two things that we want to bring to your attention right away, though, that we don't want to wait till the end, is where school funding is. Senate Finance has appointed a special work group to look at school finance, and the House has also said it's willing to put in another $1.5 billion for public schools, contingent on school finance reform, equity, doing something about recapture. So they both want to do something. Here's what would happen if we just went with I believe we're looking at the House's proposal here. If you adjusted for more students in average daily attendance, and also for the assumptions about federal local property taxes, like all the money that's in the system. What happens if we adjust for more students, about 85,000 more a year, and things costing more? We're just using the controller's inflation forecast of 2.4%. But what you see at the top, those gray lines behind, show total state, local, and federal funding per school student. By 2019, this is the better proposal, the House's one, we would be below, two years you can use as a comparison. 2011 is before the cuts that were made to state aid to school districts, to grants. 2008 is another kind of benchmark year. That's when the state share of public education was almost 50%. So getting back to the level of investment we used to make per student, we think is at least, like, that's the minimum we should be shooting for. Ideally, providing more resources to low-income students and students in special education that need more services, counseling therapists. All of that we think is like, we just want to point out the House is better than the Senate, but we really need to make up for lost ground. Also, that local line, at the bottom you see what each level of government is contributing, and you see that even that place that we end up in 2019, it's entirely because of local property taxes. It's not because of state aid or federal resources. A similar thing that we do for Medicaid, because I honestly get really tired of people saying that it's Medicaid's fault that we can't fund public schools. I don't ever really hear people saying that it's schools' fault that we can't fund Medicaid. I think people understand we need Texans to be educated and healthy. We do not have to choose between the two. But in Medicaid, similar to what we did on the other chart, if you adjust for people getting Medicaid and the state and federal funding involved, the top line is the federal share. Medical inflation is what I used here, and you see again what most of you are aware of if you've been at the Capitol. We cut Medicaid in 2003, we cut provider rates. We cut them again in 2011, so you see the access to health care that's been damaged. Patients that have been kind of triaged for mental health. There's so many things that you know that this happened because you see the lack of access. But pointing it out in a numerical way is what we do. And then we need you all to tell your human stories about what effect this has on state services. I think I'll just show you one more chart, and then we really would like to take some questions. I said at the beginning that what Congress does will really affect a lot of health and human services funding especially, but also education and highway funding. Here we're looking at something that we're really concerned about, which is Medicaid block grants or per capita cap proposals. This chart from the Center on Budget in Washington, D.C. shows what last summer's proposal to turn Medicaid into a block grant would do. In 2018, that's the first year of the budget that we're trying to write, a 20% cut in Medicaid funds to the states would mean more than a $4 billion loss to Texas. So this is the kind of thing that we need to watch out for, advocate against, because what we would do here in Texas is have to choose between denying health coverage to hundreds of thousands, maybe even millions of children, or the long-term care that we provide is not really something we can cut either. So this is the danger of a Medicaid block grant. See, I'll skip. I think we will be posting this whole presentation. I won't go too far into this other than that there are other bills that affect future budgets, not just appropriations, but policy choices like vouchers, sanctuary cities, the property tax caps that Dick mentioned for local spending. Senate Bill 9 is going to be another spending cap bill proposed by Senator Hancock. We don't really spend much in Texas, we never have, but there are people who think we need to constrain state spending even more. So we have experts available on all of these things. I'll leave that slide up there while we have Q&A. But I think the major issue is we need the budget to end up a lot closer to the House's. It's not perfect by any means, but it's a much better place to provide schools and health care and opportunities for higher education in the next 2 years than what the Senate is talking about. So any questions, comments? Anyone? Yes, sir.
Have you heard anything about members' willingness to use the rainy day fund, and if not, why not?
The question is about members' willingness to use the rainy day fund. We have actually heard some good signals. A few people, again, House actually has not appointed committee members yet, but some people who will be on appropriations have said, yes, that's obviously there, that's what it's for, stabilizing the economy. We kind of are having to train ourselves to call it that. There's been so many years of calling it the rainy day fund that people start to think it's supposed to be used for hurricane damage. So we need to make sure that people understand all the times we've used it. If you go visit a brand new member, they might think we have never ever used it. So just correcting the misimpressions that are out there is really important. We have a 2-pager on the rainy day fund. The controller has actually come out and said when are the appropriate times to use it. He's pointed out that having a really high balance just for the sake of credit ratings is not, I mean, that's not really a valid argument. There are more important things that matter to the bond rating houses. And then the main thing is, what's the point of having a savings account that you never touch? Our former director used to say, it's like having life jackets on a boat, and your boat is sinking, and you tell everybody, don't touch those, we might need those next week. So helping people understand what it's there for. And using it to buy time for better solutions. We're not saying that the Economic Stabilization Fund is going to solve all our school finance challenges, but it buys us time to come up with better solutions. Another question? Yes?
How is the $2 billion shortfall in the healthcare for retired teachers, how does that fit into this bigger budget?
The question is about how the shortfall for retired teachers' health care factors into this. At the very beginning of the year, right before the biennial revenue estimate, CPPP estimated that we needed about $109 billion in spending to cover that shortfall and to just kind of keep state services from being cut. So 109 is actually pretty close to what the House is proposing. And we've heard that the House and Senate leadership, Senate has a work group on health care that's looking into that. We haven't seen what the House is going to do yet, but they're looking at ways to deal with that without shifting costs onto retirees, because cutting benefits or making retirees pay more for health care, they understand, I mean, that's not an option for people that don't have much money and live on a fixed income. But the cost of that is something, another big issue. We don't have anybody at CPPP working on it, but we could point you to somebody who does. Another number that I'll mention, we said 109, not to cut state services. Agencies actually asked for closer to 115 billion. So what we were saying was needed ended up being a pretty conservative picture. The agencies wanted more. The agencies are all headed by people appointed by the governor, so these are not pie in the sky things that they were asking for. The TRS care fix I think was the first exceptional item for that agency, and their director does a very good job at making the case for what's at stake, why the program from the very beginning was underfunded. So that's definitely a big issue that the legislature will decide. It was in our 109, and I think it's partially addressed in the draft bills, but it's not fully taken care of. Any questions for Dick? Revenue questions? Comments? Anybody who thinks there's some way other to do this than use the Economic Stabilization Fund? The other option is for the legislature to raise taxes. So, Economic Stabilization Fund, reducing the diversion to the highway fund is another thing, but really we're talking about getting 2/3 roughly of the House and Senate to agree to do this. Yes, ma'am.
Do you remember how much of the rainy day fund they used in 2003?
In 2003, they used everything that was available in the rainy day fund. They brought it down to zero by 2005. So we had nothing, like maybe $7 million, which is like a rounding error. And everything was fine. The state's credit ratings didn't drop. 2003, the governor used it to create the enterprise fund. So they used it to create something brand new to lure businesses here from other states. The governor wants more money for the enterprise fund this year. So it's been used for one-time things, for ongoing things. It's been used to hire CPS workers. It's been used for TRS healthcare. It's been used for CHIP and Medicaid. So there's all kinds of ways that they've used it, and things are fine. I mean, as far as underfunded state services go. Yes, another question.
I was wondering, they dropped our rider 89 with 50 cent increase for it, didn't it? I was wondering if they would use the rainy day fund for that.
What we're hearing,
Improvement and retention.
yeah, the question was about the rider that would provide the increase for community care. It's rider 89, I think the lead you said. And what can happen with the economic stabilization fund is if they use it in 2017 to deal with the shortfall, that frees up money. It could free up $1 to $2 billion that they can use next time. So that could be part of something to make it more amenable. To go back to the gentleman's question, they might be more willing to use it in 2017, and then in the next 2 years, you'd be able to use more general revenue on ongoing things like that.
I was listening to you were talking about college and stuff. I go to ACC, and they were talking about, like when you can't pay your loan, some kind of program that you can pay, that they will forgive you or something. I'm not so sure what that is.
That question, I'll have to talk to you afterwards. I understood, yeah, if it's something about not being able to pay your property taxes, there are lots of arrangements, but if it's something else, I'll just talk to you afterwards and see exactly what that question was about. I will turn things back over to Oliver before he chases me out.
Thank you again, everybody. Thank you for being here again. If you sign